Welcome all to this special webinar event in collaboration with Calroy Health Sciences and Fullscript. I'm Amy Regan from Fullscript, and I'm so glad that you've joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered at the end of the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, as well as available to watch on demand anytime at fullscript.com/webinars. There is a copy of the presentation slides in the handout section for you to take notes as we go along. It is my pleasure to welcome today's speaker. Dr. Christy Morlan-Hughes is dedicated to root cause medicine, launching her private practice in 1997 after graduating from the National College of Natural Medicine. Certified in functional medicine, she specializes in addressing chronic diseases and mystery illnesses. Her practice, Ducara Vita, offers naturopathic care, coaching, and workshops. She also mentors health professionals through various programs and emphasizes the integration of coaching within multidisciplinary medical teams. Welcome so much, Dr. Christy.
Why, thank you. I'm so excited to be here. This is a topic that is, I would say, near and dear to my heart. A little pun on cardiovascular disease, but it's really been a wonderful discovery process for me in my own personal healthcare journey. So I'm excited to share with everyone with us today.
Excellent.
All right. Are you ready for me to dive in and take it away?
Yes, we are. Thank you.
I am very grateful to be here. Appreciating the responsibility that Calroy has given to me and being able to help educate you as well. This piece of the puzzle for me, this conversation around the Glycocalyx, has really been an important piece of my own cardiovascular discovery process. And post-COVID, I took the hit to my vascular system myself and found that when I was starting to work with tools and resources to do some core recovery, repair, and restoration to my own endothelial glycocalyx and some of the post-viral consequences I was dealing with, I can tell you from my own experience what a game changer it was for me, being able to jump into and really proactively work with my cardiovascular system and deal with these consequences and complications. So I'm, of course, a naturopathic functional medicine provider. I've been in clinical practice now almost 30 years, which is odd to say that out loud. I do have the honor and the opportunity to work with Calroy Health Sciences and looking at ways to educate both patients and practitioners on these themes and these topics. And I do serve as a science advisory board member and work with medical education and a few other of our industry leaders. So what I'm here to talk about today is some of the importance of the evidence that is emerging around vascular support, and that we're not just looking at the patients we would traditionally think of who are in acute or more progressive chronic stages of cardiovascular disease. But what we're learning about the need and the requirement for vascular support is interestingly touching so many at different types and different times of their health span, their lifespan. And we're going to open up that conversation today about associated related conditions that you might also be thinking about the vascular recovery process during. And for me, I love the pathophysiology. I'm so enamored with the breakthroughs that we continue to have in science and our ability to understand the cause or the cause of the cause. And what I am very passionate about, and I spend quite a bit of my time talking to my patients about, is what we've learned about the inside of the vessels and this important area of action, the endothelial glycocalyx. And then by the time we leave this session today, we'll all be thinking about some of the patients that we may be managing in our different types of practices that could potentially be also at some level of vascular risk. So why is the vascular system so important? If we really start at ground zero, we all are highly aware of the trajectory that we have seen taking place in cardiovascular disease in this country as well as abroad. Right now, we're seeing that it's around 70%. 70% of these major incidents that are involving cardiovascular disease are taking place, unfortunately, in this country. And we see that nearly half of U.S. adults are also starting to present with elevated levels of blood pressure or hypertension. Now, I love this visual. I love this little graphic, or this opportunity for us to kind of look down at this wonderful little fella. I too own sled dogs. I own Malamutes with my husband, and part of this storyline is about staying in line and really understanding what happens when things go awry. So I'm going to come back to this analogy a couple times over and really share, what are we looking for? What is the key for us? And really kind of pulling together that team, making sure that we have flow, understanding flow dynamics, because when we don't, we can see different types of acute challenges or complications, and really truly some messes that we could have prevented, or we may have mindfully been able to circumvent. So let's bring that to our cardiovascular conversation. Right. When we're looking at cardiovascular disease, again, today, it is on the rise. We've certainly seen an accelerated conversation taking place and a shift in demographics since 2020. And we are also finding that the current therapies that are available today are often not even being applied. And we will often find that for many of our patients, they're not necessarily engaged in the treatment process or understanding at what level their healthcare is working. We most certainly know that the costs of dealing with cardiovascular complications continues to be on the rise. And oh my gosh, I just was reading some statistics earlier this morning about some of the challenges per the age, per the dollar, per the year. And here in the United States, it's absolutely atrocious when we compare ourselves and we look at other efficiencies around the world. So we've got to use the tools in our toolbox here to be able to help our patients understand what is going on today in the face of chronic diseases relating back to cardiovascular disease. And this conversation today is about blood pressure flow, but not just flow and flow dynamics. It's all the other powerful and important organs that are deeply connected back to the health of our vasculature. The health of our vasculature will certainly impair, impact, or support our recovery in the bones, impacts to our eyes, as well as our neurologic system. All right, so who are the patients that we might be thinking about that could be dealing with some of these endothelial dysfunction challenges? Well, some of the pieces that rise to the surface when we're thinking about vascular complications would include certainly those who have been dealing with ongoing progressive chronic chest pain. But we look a little bit more wide and broad, and we understand wound healing, vascular recovery, oxygenation, areas, conditions, or tissues that might be struggling with hypoxic complications. When we kind of look at this larger spectrum, we see the perfusion of oxygen and the blood delivery that goes into so many of our essential organs will come back up to the surface and will correlate back to brain performance, mood regulation, movement, fitness, exercise. We might see that there can be challenges related to cognitive processing, memory, that cognitive decline pattern. And a couple areas we're going to drill down more deeply into is we're going to come back around to glucose and insulin and this important, powerful balance that we see not only for our type 2 diabetic patients, but solutions that we have that can help support blood sugar and endothelial regulation. So stepping back again, who might we think about? Those who are fatigued, who have physical fatigue, who have mental fatigue, those where we can see some distinct compromisations or challenges taking place in the vasculature. Here again, hypertension, visual complications, sexual dysfunction, looking at erectile dysfunction as one of these kind of early onset patterns to be able to understand the quality and the nature of the healing process of that vasculature tissue. So when we look at this long list, are there patients walking in your door with some of these complications? Because in my practice right now, my entire focus has been on patients who have had accelerations of chronic disease since 2020. And in this post-pandemic era, they've been impacted, or there's been influential factors that have challenged their immune system, their cardiovascular system, and honestly, the gut-brain immune inflammatory axis. Plenty of references that are available for you to dig a little bit deeper and look at the types of conditions where we see this emerging conversation around the health of the endothelial tissue in regards to also the balance that it plays with our oxidative stress. So one of the things I think is important about the data, and one of the things that we certainly see emerging today is this conversation highlighting that a lot of the known cardiovascular research that we leverage has been done on control groups and research conducted on men. And so we have certainly learned over the course of the last 10 to 20 years that women's cardiovascular presentations may be different. We've got also some underlying complications or different etiologies that can certainly set them into specific and direct risk factor patterns. So we're learning a lot about women's health care, the importance in that relationship coming back to female hormones, exercise, fitness, movement, as well as genetics and nutrigenomics. So when we think about the vasculature, I find this number, honestly, when you really stop and think about it and envision it, it's a little bit overwhelming, right? Think about 60,000 miles, right? Those of you who are European cohorts or work with the metric system, we're talking about over 100,000 kilometers of vasculature is present in the average human body. And it's imperative and absolutely necessary to support every single organ in our bodies. That incredibly important blood flow and delivery system is really key. And this is an area of focus that we are starting to understand at a much more minute level when we're coming to talking about the endothelial glycocalyx role. So such a great visual here. I've got 3 of these big guys here at my house. I take 2 males, 1 female, and they pull sled. And when things are all in a line, when things are aligned and flowing, when we have flow dynamic and we've got things creating movement and transportation through the system, it's a whole different outcome. And so let's talk about harnessing, truly pulling together and harnessing this amazing energy that these unique capabilities have of being able to support health and healing. And we're going to translate that over to the endothelial tissue. So again, why? Why is there so much emphasis today coming back to this endothelial lining? Well, we certainly understand that the vascular endothelium is covering all of those luminal surfaces inside of not only your blood vessels, but also the lymphatic system. And it is now considered to be one of the largest metabolically active organs in the body. We also know that there's a lot of action taking place at the level of the endothelial tissue. It's not just a pipe. It's not just a rubber garden hose. It's not just transporting and moving fluid from one place to the other. There's this incredible dynamic that's taking place, this contractility that's happening within that endothelial tissue, the muscular response to the environment that individual is living in, and this powerful interface that takes place of oxidative stress and inflammation at the level of the inside of the vessel. Why is this so important? Well, we do now understand that in all cardiovascular diseases, challenges to the endothelial lining itself is really the key hallmark and may often precede damage that's taking place. So let's step back a moment and think about the interface of that endothelium. What we see is the circulating blood moving through those pipes, moving through the vasculature, coming through that area where we've got this delivery taking place. But there's a lot of challenges and complications that can be happening because of the contributions circulating through the blood. The platelets can be engaged and involved. We can see coagulation patterns taking place in clotting. We can see microclotting. We can see challenges taking place with immune regulation, engaging the monocytes and the leukocyte adhesions that are a key part of atherosclerotic changes, and particularly this dance that's happening with inflammation, oxidative stress, and immune dysfunction or dysregulation. I think it's kind of interesting to think about cardiovascular disease and issues related to atherosclerotic changes happening in the tissue being considered a cardiovascular autoimmune scenario. Right, it's that inflammation in the presence of oxidative stress with that autoimmuning or the immune challenge taking place. And now the endothelial lining is that very important and strategic layer, that location that is then the interface between what's circulating in the blood and the actual vascular smooth muscle itself. When we think about that layer, that important layer of the endothelium, this is where we have vascular permeability taking place. And here's where the contractions are happening. Here is also where we can see proliferative growth responses. There can be migratory responses across that cell membrane. And here in and of itself is a place where there's kind of the pay dirt, you would say, of really looking at that redox state and where oxidative stress is managed. Looking back over the years, I've done teaching so many amazing medical education programs on these themes with some of our 4 leaders in the field. But I think here, Dr. Mark Houston, remembering Dr. Mark Houston really breaking things down from this incredibly complex perspective to the simplification of saying, cardiovascular disease and atherogenic dyslipidemias contributing to our atherogenic states are going to come back down to inflammation, oxidative stress, and autoimmunity. Our big three that we need to be so mindful of in helping our patients achieve a level of vascular homeostasis. So part of this discovery work has helped us as clinicians really understand why the endothelium is so important, because damage to the endothelial tissue precedes the developmental changes that will impact the morphological vascular changes taking place related to cardiovascular disease. So as imaging has improved and technology has stepped in for our capability of understanding, visualizing, and then eventually intervening, what emerged over the course of the last decade was the understanding of this small little space, this important little area between the blood supply and the edge of the vasculature. And that small little space that has emerged has been now identified and well understood from a function structure perspective, and that is our endothelial glycocalyx. Right, when we zone right in and we look inside of the vasculature, or imagine here you're looking inside of the lymphatics, here this covering, this coating on the inside of the vessel, it's kind of like little tiny seaweed, almost like sort of little hairs in a sense, right? Coating the inside of the vessel. That microscopic thin gel-like layer, that is made up of many of our glycoproteins, some of our key proteoglycans, and we'll see that that important soothed and coating space is what allows for the slip, the Teflon type feel of the inside of that vessel. I have found when I'm trying to describe this to patients, as much as a functional medicine naturopath, I am not advocating for the use of Teflon in their kitchen. But there is something about the imagery of Teflon that my patients really connect with. And we talk about the inside of the vasculature, that inside layer, that inside lining inside of the vessel, that endothelial glycocalyx. That healthy structure allows for flow dynamic and everything moving down the line accordingly, or things are smooth and gentle. When we have damage that happens to that endothelial glycocalyx, again, this precedes the complications of pathophysiology to that endothelial tissue, which we know goes on and contributes to conditions and diagnoses we may recognize, like hypertension, atherosclerotic changes, and this interfacing dynamic that can take place with microclots along with that tissue damage. So I really love this visual, and I can say I kind of pull this out with patients while I'm talking to them about this process, because the upper picture, that visual, helps us again remember and recognize that that healthy endothelial function, that base layer, that important protective layer is important to keep the blood flowing through, but also allows for us to have a healthy oxidative stress response and balance with our production and recycling of nitric oxide. I love the concept of thinking about this as being the vascular system's bouncer, right? That this is a very intelligent interface. There's a lot of activity that's going on here. We're storing things, we're holding on to things, we're sending out messages. And, when we have damage to that endothelial lining, if there's a shedding of that glycocalyx, what we can see then happen is reduced production and adequate recycling of our nitric oxide antioxidant. We see problems or challenges with permeability, right? We end up seeing that barrier methodology is not nearly as strong as we need it to be, right? We have vascular permeability that can be impacting fluid balance and the efficiency of that pipeline. So when looking at the function and the structure, when we remove that endothelial glycocalyx, or there's a breakdown of this lining, I think it's important to recognize that the smooth flow dynamic runs off course, right? You can see this if you've ever watched Mushers and you've got a dog off the line, or you got a dog who's got a mind of their own, right? And you see that flow being disrupted, right? We've got to see healthy barrier function to allow for that endothelial lining, that base layer, to make sure that nitric oxide is bioavailable, ready for appropriate antioxidant moments of quenching oxidative stress. And we are able to see healthy and ideal adhesion molecules relating to the inside world that's moving through it. So if we kind of hone in and zoom in on a compromised glycocalyx, you see those like little blue seaweeds in there. We don't have very many of them left in this visual of this cartoon. And you'll notice on the far right diagram, we've got some of these very important molecules like VCAM or ICAM, right? Here we've got some of our adhesion molecules that are being oversecreted or released in response to a breakdown of that lining, and they attract, they woo in, they bring in those circulating, challenging leukocytes, those white blood cells that are going to morph on into those monocytes as they migrate and they work their way into the tissue, right? So we've got those monocytes coming in, working their way through that base border, challenging and moving onward in the presence of inflammation, oxidative stress, oxidized LDL, to contribute to that shift or that change that we see when the monocyte hits that tissue, and we now start to see that macrophage gobbling up, eating up, and trying to deal with some of the debris and the challenges right underneath that base lining. So we've got communication that goes disarray. We've got structure that breaks down. We've got attraction of some of the wrong elements to the surface when we're dealing with this issue, and our capacity to manage localized oxidative stress becomes much less efficient. Our flow dynamic is compromised. Our musculoskeletal response can be seen in challenges as it relates to the overall availability of the muscular reply of that tissue. And when we look at some of the options that we're dealing with from a clinical perspective, many of the things that contribute to the damages of the glycocalyx are things that I'd say, honestly, most of us in clinical practice today are already coaching to, advising to, or making recommendations around, quite frankly, right? What causes this level of inflammation and oxidative stress? These are many of the things you're already treating and you're managing. So what I want to make sure that you're understanding is all of the directives for us understanding what sets up the causes for these patterns. It's lifestyle, right? So much of this can be lifestyle. And when we're looking at some of those altered, challenging healing patterns or some of these imbalances, we want to look up the family tree. We want to be mindful of where there's a familial trend or potentially a genetic complication. And then we also want to be very mindful and aware of what life and the environment can be doing to increase or accelerate somebody's risks of this kind of vascular challenge. So some of the traditional risk factors, as you would expect: high blood pressure, insulin resistance, type 2 diabetes, lipid alterations, those lifestyle patterns we talked about with smoking, even obesity trends that are also secondarily linked back to sedentary behaviors, right? We certainly see some key lab factors we might want to be watching for, the elevated homocysteine challenges. And an emerging conversation right now is hormone imbalances. And again, here, low levels of estrogen, progesterone, and bioavailable levels of our total testosterone may be playing an important role differentiating women from men in our cardiovascular story. Right. We also do see that certainly for males, we can see those altered levels of both total testosterone being depleted and free testosterone levels of being low, carrying over some of those higher risk complicated patterns. Now, thinking chronic inflammation, there are specific and certain autoimmune challenges that might rise to the surface of our consideration. There are strong links between rheumatoid arthritis patients having increased cardiovascular challenges, patients who might be dealing with SLE, or psoriasis patients, or those dealing with an inflammatory bowel disease might also find that because of that systemic inflammation, there's a crossover pattern here. Now, what many of us in the functional medicine world are touching, and those of us who do integrative care, we're thinking about stress, right? We're thinking about the HPA axis. And for many of us, that expands to the HPATG axis, right? Thinking hypothalamic, pituitary, adrenal, thyroid, and even potentially gonadal axis. We also know that major sources of inflammation and oxidative stress can be happening inside of the gut, that microbiome, or a dysbiotic GI tract. They could be contributing to or dumping endotoxins into the system that are putting a higher burden of oxidative stress within the cardiovascular tissues. Being very mindful of toxins, biotoxins, as well as environmental toxins. And then some of those traditional challenges where we look at volume overload, we look at any type of injuries or incidents that might have led to an ischemic impact, a hypoxia challenge, and then bugs. I see a lot of infections, pathogens and infections that could be in the system somewhere contributing to a wider felt experience. Some interesting areas that have really emerged in the last decade or so include some of these infections that can be in the mouth, in the jaw, in the bone, hidden infections, stealth infections that can be contributing to these levels of inflammatory waves. So when we think about what's going on, the cause and consequences, what's going on inside of the endothelial tissue, we know that one of the major factors that we're focusing on is looking for those risk factors, identifying oxidative stress that might be present, and then going on to understand the downstream cascades, right? The impact can be to that endothelial glycocalyx itself, which when it becomes dysfunctional, it leads to vascular damage. And we simultaneously see challenges that relate back to a decreased, reduced ability to make or produce healthy levels of nitric oxide for that very important role of oxidative stress management. So it's not just happening in the vasculature. What we are finding is the vasculature impacts the system overall when we're talking about inflammation. And when there is inflammation that can be present there inside of the vasculature, we see this wide-reaching impact certainly can be felt. So we want to be thinking about this as an important contributing factor between inflammation and some of the other particular roles that we're seeing in the cardiovascular conversation. Then layering on top of it, inflammation. When we've got that inflammatory culprit, that drive of inflammation, now we've got a second impact that's layered on top of our cascade. And we find that the more widespread vascular damage that takes place, it can feed forward into that endothelial dysfunction, causing more inflammation, causing more impact to that internal lining of that endothelial glycocalyx. And again, this ongoing endothelial tissue response will become a feed forward cycle. So there are some pretty exciting things that we can think about, and there are some tools in our toolbox that we might want to draw on, or maybe some of the pieces that we want to bring into and integrate into our own private practice. So let's talk about some of the things we can do internally to support restoration of that endothelial glycocalyx. So recall, big takeaway. I think this is an important clinical application. When there's been damage to the endothelial glycocalyx, that damage comes before a deepening of that process in which the endothelial tissue becomes damaged itself. So know that when we're looking at protective factors, when we're thinking about ways that we can nourish and we can support the vascular tissue and the lymphatic response, we're going to want to step back and think about the big picture of lifestyle. Right? For most of us, this would absolutely and obviously include supporting someone with diet, food choices, and maybe even rhythmic eating times to support their glycemic control. Right? We are certainly living in an era today where the discussion and the conversation around glycemic control is more available than ever before. Our patients are more educated than ever before and informed, right? The use of being able to bring in CGMs, those continuous glucose monitors, and having an app on your phone for that patient to be able to connect the dots between eating and their immediate blood sugar response over the next couple hours. I mean, this is an amazing tool, right? Amazing tools in our toolbox that allow for us to help encourage our patients to pay closer attention and to be able to watch for the progress. So when we're working on restoring the endothelial glycocalyx, diet, food first. I mean, that is absolutely one of the most important places we want to begin. And we want to ensure that the food plan and the dietary instructions that we're coaching our patients towards also involve a healthy glycemic impact. So insulin sensitivity and supporting a diet that will not allow for high spiking of glucose out of control. We want to make sure that the diet is also rich with nutrients. There's some brilliant data that looks at phytonutrient diversity. We can see more color, more life in the form of different types of flavonoids and those important phytonutrients represented in different color. When we look at the variations of color in the foods that we're choosing, it goes hand in hand. Phytonutrient diversity goes hand in hand with some unique aspects of phytonutrient density. So a colorful variety of different types of plant-based ingredients in our diet is also helpful in controlling blood sugar regulation. We certainly see stress playing a role both in stress eating and looking at the neuroendocrine response to stress, toxin removal and various different levels of helping support the body through detoxification can bring great benefits. and fitness and movement and exercise. These here being some really key resources for us to bring that lifestyle factor forward. Now, what do you do if your patient's already doing all those things and they're still struggling and they're still dealing with challenges, and that might be impacting their blood pressure regulation or their blood sugar response? Well, there are some tools in our toolbox that we can draw on, and some unique discoveries that have taken place that we can use in a natural medicine oriented or a focused clinical practice. So again, gosh, we want to make sure that all of the elements inside of that pipeline, inside of that vasculature, are thriving. We want to make sure, we want to ensure that healthy ideal function is there and everything is working up to its highest performance. Gosh, I love looking at this dog. We've got puppies who are in the snow. We actually have some snow outside here in Minnesota today, and it was so much fun to be able to open the windows, open the doors, and let them go running out, to be able to kind of catch those first waves of the snow that's been coming through with this particular season. So, it's exciting and wonderful to kind of connect the dots and understand there's so much involved in that full balance that we're looking for. So I have to say, I have a personal relationship with this plant now. I would say the extracts that have come from Rhamnan sulfate, which we certainly see is derived from this marine-based polysaccharide, right? It's a seaweed. And the Rhamnan sulfate is the active ingredient that has been brought back into our conversation surrounding natural medicine applications and ingredient choices that can help us support and heal and repair the endothelial glycocalyx. So how was that discovered, and why this particular Monostroma nitidum? Why this particular seaweed in comparison to others? Well, when we look back at some of the research that was done, there was a live microfluidic chip, this live model that was built that had inside of it living endothelial glycocalyx cells. And what was done is there was assessment and testing looking at function and performance, and there was a breakdown of that lining induced based on different situations and scenarios. And there was discovery work done around looking at the important relationship that blood sugar has on the endothelial glycocalyx. Well, one of the interesting discoveries came through integrating and bringing along Rhamnan sulfate, adding it into that microchip fluid flow, moving through that response to be able to see the healing that took place at the level of the endothelial glycocalyx. And there was improvement in the tissue response, as well as some interesting helping agents or components that can support our patients who are dealing with blood sugar response. So this is an example of what that looked like, right? So here is our microfluidic chip study. They were testing and assessing that Rhamnan sulfate, looking at how well is it tolerated. It has come through the studies and the research being not only known for its protective nature, but also the discoveries are not only does it protect the endothelium tissue, but it helps regenerate some of these challenges or some of these risk factors that we've been looking at and identifying. It is extremely well tolerated in humans, and there are no known safety concerns at this time with this extract, again, coming out of the seaweed, Monostroma nitidum. Hey, now I think this study is pretty exciting. So what they did is they looked at the control response, somebody who had a normal, healthy, ideal glycocalyx. And in this study, they were understanding some of the dynamic that takes place with blood sugar and the impact on that endothelial glycocalyx response. So take a look here. That fluid cell was challenged with higher levels of glucose. And the response that took place was a change in the quality of the lining of that glycocalyx material. When there was an addition and support brought in of the Rhamnan sulfate that went along with the high glucose challenge, not only did that tissue maintain its ideal status, but there was even a higher improvement. That tissue responded in a healthier way than even before the first process began. So what you will see is there is wonderful studies and data and conversations taking place around the powerful role that the form of Rhamnan sulfate has on restoring the endothelial glycocalyx, not only from the level of its integrity, but its function. So again, looking at what are the known principles of this ingredient, right? What we find is it's antiviral, plays a powerful role as an anticoagulant. There are studies linking it to anti-tumor activities. It plays an important role in looking at cholesterol management in taking place within the lining of the vasculature. And we also see this decrease in blood sugar and improvement with weight control. These are some of the more well-known connections bringing us back into clinical practice. There also is data looking at some of the roles in which we can have benefits of Rhamnan sulfase inhibiting some of that endothelial cell inflammation that will go back to looking at alterations or challenges in clotting formulation and that direct inflammatory response. So what about the endothelial glycocalyx today? Like, if all these things can contribute to these problems and it's that unbelievably fragile, like, what can our expectations really be here? And I think one of the really important takeaways, I think one of the important clinical ahas is recognizing that, yes, there's a level of fragility to the endothelial glycocalyx, but there also is an incredible response and an improvement in regards to its ability to heal and to recover very quickly. It may be fragile, but it's also extremely resilient. There are things that can come through the pipeline of diet. It could be that sugar surge or that carb surge on your Thanksgiving holiday, right? Or kind of eating out of line with how you typically will consume your carbohydrates and balance with your other macronutrients. But here we can see that, yes, when we have that ongoing hit over and over and over again of the elevated levels of glucose, or we're developing an insulin resistant syndrome where an increasing level of that glucose is present, elevated hemoglobin A1C levels, this may be a tool in your toolbox that you might want to implement, not only to help improve the blood sugar response, but to protect that cardiovascular system in your patients who might be presenting with higher levels of susceptibility. Right. We're talking about going upstream, right? We're talking about looking at inside of that vascular lumen, seeing that presence of where that glycocalyx interaction is and the role and the relationship that it has back to that endothelial base tissue. So do consider, when I think about these patterns, I think, gosh, do you remember the era before people talking about the microbiome? Right? There's sort of this era of practicing integrative medicine before the microbiome, and now everybody's talking about the microbiome. Right? Leaky gut, right? We have these stories about the leaky gut and the importance of healing the integrity of that tissue. Then we've gone on to hear conversations about leaky brain, right? Leaky gut, leaky brain, the importance of that healthy blood-brain barrier function, some of these important relationships and roles between the gut-brain, endotoxemia, internal toxins, and neurologic brain response. And now what we are seeing emerging is this very important conversation about leaky vessel. Right? We've all matured and grown through the leaky gut, leaky brain, and we are now starting to see more and more discussion and conversation happening around the role and the importance of supporting this vasculature to be able to bring together and unite and heal our patients who are eating great, who are open to reducing inflammation, who are doing the right things in lifestyle to move their body, get sleep, get rest, work on their restoration process. Right? This is an important piece of our conversation. Now, know that when all those right things are taking place, we've got these tools. We've got the opportunity to bring in and integrate some of these powerful ingredients to aid our process forward. So who and why? I am wondering if for you that you started thinking about some of the types of patients that you might want to support their vasculature with. When I think about my own patients, for me, a very big part of my patient base right now are those who have had some vascular injury or damage in this post-COVID era, who are dealing with post-viral challenges. So for me, it's many of my patients presenting today who have a recent history of fatigue that's following various different viral exposures that they've had. Or for me right now, it's my patients who are presenting with hypertension, with type 2 diabetes, those who are challenged or those who are dealing with some of the consequences or the downstream complications of an insulin resistant type of a syndrome or a full metabolic syndrome, if you would say. All right, some of these are some of the more important that I'm looking at in my own practice. That code history of recent infection, take a really good detailed history. Make sure that you're understanding the sequencing and the timelines for your patients most recently, making sure that there isn't a connect the dots between experiencing a viral insult to the system and then finding that a fatigue followed, finding that there was a post-viral fatiguing that could be there. I certainly connect the dots with my sleep apnea patients, thinking about where and how did that emerge and what kind of a connection might that have going back to an insulin resistant type syndrome. And then I do take the time to really hear out and make sure I want to have a strong understanding of their cardiovascular complications or challenges that they may have had. So going into the history, right, I'm looking for fatigue, I'm looking for brain fog, I'm looking for challenges that relate back to this sort of kind of a quick onset of some of the issues that we've talked about relating back to inflammation. All right, so big takeaways and the big picture, and we'll open up to some of the questions that some of you might have. Kind of clinical takeaways, right? The endothelial glycocalyx damage that takes place, when that happens, it precedes our endothelial dysfunction. And when we're dealing with the endothelial glycocalyx, remember that it plays an important and a very powerful role as it relates back to nitric oxide production. The quality of that base is very important, and there's much more to be said on this topic. And then know that Rhamnan sulfate that does come from this monostromal actinium, it's a very powerful and a very safe glycocalyx supporting compound that can be integrated and brought forward. And then Rhamnan sulfate coming again from that monostromal actinium, don't forget about it, as it plays such a beautiful role in helping to not only protect, but also to restore damage to that endothelial glycocalyx. And in my own experience with this ingredient, and in working with literally a few hundred patients now over the course of this post-pandemic era, I can say it's been very impressive for me as a clinician to be able to feel, experience, and watch and observe in my patients some of the relief that comes as you can see them starting to shift and change their response within that vasculature. So kind of big picture, right? Everything in line, good flow dynamics, everything working together, having that level of continuity and that congruency being present, right? We really want to make sure that we are supporting that vascular response, right? When we know that we're helping to heal the vasculature, we're reaching every organ in the body. And we certainly know that, when working with appropriate, healthy, ideal blood flow, we're also going to be able to support the demands that an ideal fitness and athletic program will bring to the table. And then kind of playing on words, that harnessing, right? When we're working with healthy vascular health, we know that it's really key and important to not only harness the abilities and the capacity of the vascular system to orchestrate such an important responsive communication to our system, but our overall health and wellness, including brain perfusion, muscle perfusion, organ perfusion of oxygen and adequate nutrients, really comes back to the health and the dynamic of these pipelines that are carrying things through the system. So I'm excited to open up some of the conversation point around clinical applications. I know we're going to end the recording and shift gears and answer questions, and I would certainly open up and talk a little bit more direct about my own experience and the types of cases that I have been successfully using some of these ingredients for as a part of a bigger picture. And I just want to, again, thank the team that has pulled together the resources so that you too can jump on, look at your vascular health protocol, kind of dig a little bit deeper down into the weeds of what are some of the options for healing the response to these tissues. And again, always remember food first, healthy diet, healthy lifestyle, and then we want to augment those empowered, important choices our patients are making with these super ingredients.
Excellent. Thank you so much, Dr. Christie. And everyone pop their questions into the chat. It's also my pleasure to introduce Anita Hayes, who is the Senior Manager of Scientific Affairs for Calway Health Sciences. We are just getting connected with Anita now. Excellent. Welcome, welcome.
Hello.
So we've got a number of questions coming in. And the first one I see is, how can we test vascular health beyond calcium score and advanced lipid panel to assess the glycolyx?
Let me just see. Are you reading questions down the side?
Yes. Yep.
Okay, sorry. I was multitasking with you. I was trying to find my way through. Which column are you in? There's a whole line of the answered questions already.
We are in the new. If you go to Q&A in the new. Yep. And I just read off the number 1 question there.
Okay, so let me see. How can we do? I do think that that's actually probably the most powerful way to do it. I think that's where the studies have been coming out and really identifying and really showing that proof of concept. For me personally, I am also going to be looking at the indirect and the peripherals. I'm going to be tracking and following my fasting glucose, fasting insulin. I'm going to be looking at 2-hour insulin response patterns if I'm lucky enough to be able to track or follow those periodically in a patient. Simply, I'm going to look at a hemoglobin A1C, of course, and I'm going to use that as a gauge. And then I'm going to keep a close eye on the triglyceride levels. I'm going to watch a triglyceride and HDL ratio. I want to see that level low under 3. It's another great indication that we're starting to see the biomarkers starting to drift and shift in the proper direction that we're looking for. I would say those are going to be probably kind of the leading the charge. A couple of the subtleties that I also throw into the physical exam is I want to ask questions about perfusion of oxygen, and I want to use simple tools like a pulse ox. I want to be able to watch and make sure that my patient is able to demonstrate and model some of the, I would call them more gross tools that can sort of pick up some of the challenges and complications that we saw a lot of activity over the course of the last 4 to 5 years in this post-COVID era. Anita?
Yes, I'm going to add that in our clinical trials, we always measure the ADMA lab values to correlate with nitric oxide levels. And one score that we also check is the carotid intramedial thickness with the CIMT, because that doesn't involve radiation and can be repeated every 6 months.
Mm-hmm.
Excellent, excellent. The next question we have is, how can you evaluate if supporting the endothelial glycolyx is changing a patient's health overall? What biomarkers or metrics do you look for?
I think it's the same question, same answer, different question. And I'm going to throw in there, I'm also going to be having the patient track and follow some of the screening questionnaires that can be used for tracking overall health and improvement in vitality. So I like using medical symptom questionnaires to really track and look at some of the specifics that are happening. So I like using some of those additional subjectives. And the big thing I'm looking for is energy, fatigue, and blood pressure regulation, blood pressure response. And my patients have access to using any other biohackers or their ring or their watch or something that they might be using to be able to get deeper insight. I also would like to have them take a look at HRV and overall how their body's responding to stress. So I think kind of this interesting dynamic that happens at the level of the vasculature where stress and inflammation interface. So don't hesitate to use some of those tools and resources. In my own patients, you know what I love? They say, I can think more clearly and I have more energy. That's what they tell me. Their blood pressure may shift, and over the months that go by, we might see the biomarkers changing on those labs we're tracking every 12 to 16, to 24 weeks. But what they tell me is my brain works better. I'm thinking more clearly. I'm feeling better, and I'm able to do more. And I really love that extra burst that people get, that application that they can take into their fitness and their athleticism, because I really think this is an important piece of the puzzle for a lot of our fatigue patients today.
Mm-hmm. I would just add that if you have access to an autonomic nervous system function, you'll be able to see microvascular changes in the peripheral, a palmar and plantar, if you have access to that. Arterial compliance also with some devices that not everyone has access to, like the endopat and the pulse waves.
Mm-hmm.
Excellent, excellent. Maria asks, what are the dosage specifics for Rhamnan sulfate used in the microfluidic chip study and in your practice?
Well, I can speak to my practice and what I've been doing as my standard of care for the majority of my patients. I'm dosing them 2 a day, is our standard maintenance plan with the majority of our patients. In some of my practice, which honestly is a pretty large part of my practice, I'm dealing with many long haulers. And so what I will often find I do is I do loading doses of the formula. And so I will bring those formulations in a little bit higher doses for some of my more fatigued and exhausted patients. What I'm in, especially if there is a direct clotting incident or a post-stroke incident, or we're kind of dealing with more of these direct complications from thrombotic issues or inflammatory cascades, I may do a high loading dose of around 4 a day, often for 2 to 4 weeks. And then I'm going to drop back down to maintenance, which is 2 a day. I would say probably 50% of my patients, after they've come through a long hauling post-viral recovery experience, will within 6 months be able to drop down to just 1 or 2 for maintenance every day. And I keep it as a part of everyone's maintenance plan going forward.
Mm-hmm.
I'll let Anita also address.
Yes, we in a neuropathy study, we did the double dose, 2 in the morning and 2 in the evening for peripheral neuropathy support to see an effect. Now that there is a nitric oxide product separately, we would just dose that in addition to the Arterisol.
Mm-hmm.
Excellent. Excellent. The next question we have is, can you please explain again the connection between insulin resistance and sleep apnea?
Well, for many of our patients who are dealing with an insulin-resistant syndrome, part of that cascade and looking at that picture, we've sort of got this secondary peripheral array, right, of different conditions that we think about, and we put sleep apnea right on that same list, right? We think of some of these secondaries that go hand in hand with the insulin-resistant syndrome. So we've got a hypoxia challenge that takes place. The oxygen delivery capacity is compromised, and so it's a really powerful and effective tool. We find that many of our type 2 diabetic patients will respond to healthier blood sugar levels if they get on a CPAP, and they're getting a much healthier response of sleep at night. So I'd say it's this sort of back and forth infinity response pattern, right? So for treatment and care, we find that many of our sleep neurology partners in healthcare are those practitioners that we refer with. Once we can get some of the sleep apneic challenges under better control, there's also a healthy daytime improvement in blood sugar response.
All right.
I love this question about the Beamer.
Yes.
I would love to jump into that. I'm a huge fan of Beamer. I've been around it for years. I use a lot of tools and technologies in my practice. I run everything from microcurrent therapies to I've worked with, various different resources, lasers. I love Beamer. I think what's so interesting about the Beamer is it's known for incredible research Beamer has on the microcirculation response. And I mean, they have been studied at NASA. There is Beamer technology is a big part of the astronaut suits. It's so helpful. And so what Beamer does is it improves microcirculation. And so you lay on a mat or you wrap it around an injury or an area of the body that's complicated, in the perfect world, when I think about some of the clinical tools and resources, if you could lay on a Beamer mat and you were taking adequate nutrients, you had your foundational nutrition, magnesium, CoQ10, and you added your, Rhamnan sulfate on top of that, and then you also improved the vagus nerve. To me, it's like that would be the ultimate of being able to pull the best of the best of the best of your tools together. So I would say if you're running a Beamer, this ingredient and this has to be in a major tool in your toolbox. You will get better results with what you're doing, and using a Beamer will help speed up part of that process and driving that oxygenated blood supply into those different tissues. It's just a win-win. I'm a kind of an advocate that if you use Beamer, this is an ingredient you want to know about because your patient population is going to respond, I think, much more effectively.
Definitely.
I don't know, Anita, if you work with Beamer or what your exposure is, but I've been around it for years, and I think it's just a perfect win-win.
We've been testing, Dr. Houston's clinic's been testing it, and very positive. Yeah.
Good. I didn't know that. What a great, that would be just an absolute clinical no-brainer. I mean, just a wonderful tool in integrative medicine, right? Kind of bringing together some of our physical modalities.
Yeah, definitely. Thinking, especially too with neuropathy, I think it would just be perfect.
I mean, I just in vein with that same conversation, one of the combinations for me in a lot of my post-COVID vascular inflammation healing is I've been running microcurrent therapies, running vascular inflammation programs while taking my formula. And that's another way, really going after a vascular repair and recovery, right, with microcurrent therapies. So I think if you're doing any kind of vascular rehab, if you are working in cardiovascular rehab, I mean, these are win-wins. We've got these beautiful tools in our toolbox that give us the capacity to improve function, boost ATP, and really get the tissue responding quicker. I absolutely love the integration of bringing the two together, but you don't need the tools to get these results. And so I'm saying I have run a couple hundred patients, through over the last couple years, some of these tools and resources without the awesome, amazing gadgets that you can have in your office. And we're still getting great results, right? So I just want to say you get good results without, you get kind of exciting, kind of even bigger bumps if those are any tools that you already have in your toolbox that you're using in your practice.
Excellent. April has a question. They are taking one Arterisol every morning and night, and their husband is taking Vascular. Can you comment on how you choose between those two in general?
I'm going to say it's an and, not an or. Anita might have a different answer. But
Yep.
for me, I'd share the bottle. If anything, I'd have you each be taking one a day for maintenance or one or two a day of each. So I think it's a win-win. It's a great combination because I think if you can improve the nitric oxide production and the body's natural endogenous recycling capacity inside the endothelial tissue, I mean, that is the one benefit that you get with Vascanox. It's a really superior formula that's coupled with that arterosyl. So if your goal is hypertension management, I would be doing both. It's an and type of a situation. Honestly, I would say probably more than 50% of my patients, I'm using both of those two tools in the toolbox because I'm really wanting a deep support in reducing inflammation, the oxidative stress, while I'm healing the Teflon inside of the vasculature.
Right. And I consider arterosyl the supplement that repairs the road. It repairs the vascular system. Vascanox is that little Porsche that does the fast drive delivery of nitric oxide.
I love that. I love that.
Great. Excellent. Margie asks if, can someone with a shellfish allergy take the product since it is seaweed based?
We have not had an allergic report to the Rhamnan sulfate. And it's about a 300 milligram dose if you were to divide it out. But since I've been looking at all the companies' filings, we have not had a report of an allergic reaction.
I haven't clinically seen one either.
Excellent. All right.
Ooh, this last question, I am so lit up about this last question. I don't know how long you have, but boy, I would love to answer this question. Wow. I am finding that there's such a powerful and important connection with these EDS patients, these Ehlers-Danlos patients, interestingly getting activated in this post-COVID, post-viral era. And so we're seeing a lot of people who had the genetic predisposition to the sort of loose and generalized connective tissue patterns that accelerated or became more problematic in the last few years. What we're dealing with, right, is this importance of delivering oxygen and nutrients into the connective tissue. And the connective tissue is really hard to get nutrients into. So this being a win-win, right? Most of our patients with EDS, interestingly, might also have histamine-related disorders, and they may be dealing with MCAS problems. And I'm finding that my mold and post-COVID patients who had EDS maybe didn't even know they had EDS until they got exposed to one of these viruses or potentially the exposure to mold and mold biotoxins. So I think this is a big story going on today. We're seeing a rise in EDS presentations. Kind of the classic picture is going to be leaky gut, right? So EDS patients have a lot of challenges with a leaky gut. So yes, this arterosyl would be an amazing part of that healing journey. Two, you have to tackle the vagus nerve with these patients. That plays a very important role. A lot of them also have vestibular injuries, which is interesting because the cochlea in the inner ear, so they have dysautonomia and they have problems with vestibular injury. Right. And so this is an important subgroup of our EDS patients. And it's because the connective tissue disorder impacts the positioning and the structure of the inner ear as well. So screen for, test for dysautonomias in those EDS patients. Right. And if you haven't done that kind of a super simple screening, just get out your tuning fork, bang it, stick it right here, and you're asking the patient if that vibration is lateralizing to one side or the other, or is it equally heard in both? Because if you've got a tuning fork lateralizing, right, what you're going to basically end up with in that patient is you're going to know that there's an inner ear injury there. So your EDS patients, high risk for pain syndromes, right? They're going to be higher risk for inner ear, dysautonomia, problems with vestibular challenges, vestibular triggering. And yeah, I think this is such an important area of patients that they need help, and they got to figure out if they've got the histamine connection as well. So there's foods they could be avoiding that would make them feel better. And absolutely, I think the use of arterosyl is a great adjunctive tool in supporting them on their connective tissue. They have to learn how to live with it, right? And so they've got to learn how to very carefully treat and manage. And just, yes, frequency-specific microcurrent absolutely treats EDS in a way that I haven't seen such fast responses. So there's some pretty amazing tools to integrate these resources for EDS. And I am in Minneapolis. I'm in Minnesota.
Excellent. And a good follow-up question for about EDS is, can it present with tracheal melanosia?
I don't know. April Morgan, that's a really smart question. I don't know. But it's a great question. I like to have great answers to great questions. It's a really good question. Sorry.
Excellent. All right. So we're going to tackle 2 more questions if everybody's got a couple extra minutes. I didn't mean to make the balloons go off, but that's fine. April also asked, if your blood pressure runs normal to low, should you avoid Vascunox?
Anita?
Yes, I'll take that one. I would say if you're normal to low, I would test with 1 capsule in the morning instead of 2. And also, we have found as a company that people with small stature, usually women with small stature, respond better to 1 capsule than 2. It is a good potent vasodilator, and some people feel tired when they take 2 if they're small stature. So I would start with 1 capsule. And if you have access to the testing strips, test to see if the 1 Vascunox will turn you fuchsia, will turn your strip fuchsia.
Yeah.
Excellent. And Stephanie asks, have you seen RS be successful to help with tinnitus? If Rhamnan sulfate repairs vasculature in the brain, maybe this could work. Any thoughts on that?
I think it's a great line of question. I am sad to say there aren't very many things I've seen that do work, especially when you've got that level of damage into the tissue. So I think you've got to know the source. Was it maybe a virus that contributed? Was it infectiously driven? Was it trauma? Was it head injury? I think the source of that tinnitus is really important. And so I personally haven't seen it work. I think it's worth extrapolating just to see. Again, low doses, 1 or 2 a day, but I think your answers will often come in the how did it happen or how did it come to be. But boy, that's a tough one to treat.
Yeah, Dr. Houston had seen patients with tinnitus, treated them with all of his supplement arsenal, but it ended up actually being referred for hearing aids. That was where they got some relief. So.
And look for toxicity, right? It's often virus or a toxin that's contributing. And in those scenarios, then you would need to clinically go down a different path.
Excellent. Well, thank you. Thank you so much to everyone who attended today. And also thank you to Dr. Christie for this great presentation and to Anita Hayes for joining us. I really appreciate both of you being here this afternoon. Everyone take a look out in their email for a link to this recording in a couple days. And anyone who has any additional questions can send them right over to me. My email address is amy.regan, R-E-G-A-N, @fullscript.com. I hope everyone enjoyed this presentation today and has a wonderful afternoon. Thank you so much.
Thank you all.
Thank you.
Everyone.